Minister, yesterday you tweeted about a newborn and a tween in ICU with COVID. So I'd like to know what you can tell us about their condition, where they're being treated, and why would you reveal such serious news as an elementary-aged child and a newborn with COVID on Twitter without any details or context for parents?
So first of all, what we're providing is information that's been requested, age information about who's in the ICU and who isn't. And happy to report that the infant in ICU has been discharged healthy, and that's good news. We don't talk about the cases in general, but we've provided information about all the different age categories, and I think it's part of what we're going to continue to do to tell people what the situation is with the seriousness of COVID-19. And what we see in a general sense is under 50 people, almost all of our cases, if not all of our cases, are unvaccinated. None of our cases under 50 yesterday were fully vaccinated. So the reason we provided that information, which we've done for a few days, is to give people detailed information about about who's sick and what their vaccination status is in our ICUs. And the information won't change very much today. There will be that update. You won't see the one case there, but you'll see that approximately 140 people are in ICU today dealing with COVID-19, and that the vast majority of them, I believe 121, will be unvaccinated. And I think that's useful information for people to know that, in fact, the small group of people in BC, and it's now down to 14% of British Columbians who are unvaccinated, represents a large share of the population. So that's the information, and we're providing that information as we do in some of our detailed updates, and we'll continue to provide that information. And obviously, with respect to the one case, it's good news. We're providing people, I think, with the best critical care in the world. And you see that in our results, that people are recovering, but that recovering when you have COVID-19 is hard.
Penny, did you have a follow-up?
I do, yeah. I guess I still want to know about the elementary-aged child that is still 10 to 12 years old that is presumably then still in the ICU. And what can you tell us about children that are hospitalized? Even if this ICU stay was fairly brief for the newborn, are they still in hospital? What is the average stay for children in hospital? This is the kind of information that parents are really concerned about when they see what's happening in other jurisdictions.
You know, when we provide this information, some people asked about children in ICU, and there weren't any children in ICU. And right now, I think there's one in ICU receiving critical care. And what we do have is a fairly low barrier for critical care, so we want to make sure people are well and get the best possible care. We don't talk about the individual cases, as you well know, Penny, but what I can say is, and what those numbers show, our ICU numbers show by age group, is pretty straightforward. That people who are unvaccinated right now are at risk of some serious health effects from COVID-19, and 121 people, when you consider that we have around 520 baseline critical care beds across the province, and then we've added, of course, surge beds, about 230. And we have about 430 people in those beds right now. You can see what a large percentage of the people in ICU in BC are dealing with are unvaccinated people dealing with COVID-19. That their risk is high, the impact on unvaccinated people of the Delta variant can be significant, and that's why we want to encourage everyone to get vaccinated. So we're going to provide, and we're continuing to provide, detailed information on cases, and you'll see that, for example, in the weekly reports that are put out by the BC CDC and the daily reports that we're putting out as well to show and lay out to people the impact of vaccination. But I think what people need to know is that what we all should do is get vaccinated. And overall, and you've seen, because you review these every week, you've seen the hospitalization numbers. Overall, we've had a very low rate of hospitalization amongst children and youth since the beginning of the pandemic, and that continues to be the case now.